Hi guys, welcome to Radiology 365, and today, still on our topic of pulmonary infections, we are going to be talking about atypical mycobacteria, fungal infections, and viral pneumonia. So there are three types of atypical mycobacterial infection. The first one is the classic or the nodular cavitary form that simulates TB. Typically, it's seen in patients with chronic lung disease. Then there is a non-classic or bronchiectatic form, which is the more common of the three types. Lastly, there is the disseminated form of atypical mycobacterial infection that typically causes lymphadenopathy in immunocompromised patients, usually AIDS patients. The presentation of bronchiectatic atypical mycobacteria is an elderly woman with a cough, low grade fever, and weight loss called Lady Windermere syndrome. Now, the name Lady Windermere syndrome is coined from one of Oscar Wilde's plays, Lady Windermere's Fan, where there's this woman, Lady Windermere, who had Victorian era kind of manners, and so she wouldn't be caught dead coughing. So she would hold in her coughs and hold in all the sputum in her chest. Now, it's noted that when you hold in your coughs, coughing is a defense mechanism where you bring out foreign substances that are not supposed to be in your chest. So when she holds in her coughs like that, or when people, old ladies, hold in their coughs and hold in all the sputum and all that, it serves as a medium for culturing organisms, in this case, atypical mycobacteria. Now, Mycobacterium avium intracellulare and M. consacii are the two most common organisms that have been implicated in the bronchiectatic type of atypical mycobacteria. The radiologic findings are bronchiectasis, that's dilatation of the bronchi, and tree in bud nodules, most common in the right middle lobe and in the lingula. There's another entity called hot tub lung. Hot tub lung is a hypersensitivity pneumonitis in response to atypical mycobacteria. That is not to say it's an infection, but to say it is hypersensitivity pneumonitis. Hypersensitivity is like an allergic reaction. So it's an allergic reaction to the exposure to the mycobacteria, not necessarily proliferation of the mycobacteria causing infectious causes. I mean, the symptoms are quite similar, except if you were actually infected, you would have other signs and symptoms like fever and the like, which are absent in this hypersensitivity response. There is no active infection, and the typical patient is otherwise healthy. Imaging is similar to other causes of hypersensitivity pneumonitis, where you would see centrilobular nodules. So in these images, it's a case of Mycobacterium avium intracellulare infection, and in this coronal CT and axial CT, it shows right upper lobe and lingular tree in bud opacities here and bronchiectasis. You can see this varicoid kind of bronchiectasis, dilated bronchi here and here. And in the axial, we see this more focal consolidation here. Then we have certain fungi that can also cause pulmonary infections, and most of the time they are endemic in certain regions. So if you have endemic fungi, they can cause pneumonia in normal individuals, and the subtypes of these endemic fungi have a geographic distribution. The textbook we are using is Core Radiology, and it focuses on Histoplasma capsulatum, coccidioids, and blastomyces dermatitidis, which are endemic in certain parts of the United States of America. And so those are the fungi that were discussed in this book. So Histoplasma capsulatum is localized to the Ohio and Mississippi river valleys in soil contaminated with bat or bird droppings. The acute infection usually produces nodules and lymphadenopathy, and then the chronic sequela of infection causes calcified granuloma. A less common radiologic manifestation is a pulmonary nodule called a histoplasmoma, which can look like a neoplasm. Then fibrosing mediastinitis is another entity that we should know about as a manifestation of this histoplasma capsulatum infection. In this situation, the mediastinum gets massively fibrotic, leading to pulmonary venous obstruction, bronchial stenosis, and pulmonary artery stenosis. And it's as a result of infection of the mediastinal lymph nodes, which tend to calcify. Coccidioidomycosis is found in the southwestern United States and has a variety of radiologic appearances, including multifocal consolidation, multiple pulmonary nodules, and miliary nodules. These descriptions we have seen in previous lessons. Blastomyces dermatitis is found in the central and southeastern United States. And infection is usually asymptomatic, but it may present as flu-like illness that can progress to multifocal consolidation, ARDS, or miliary disease similar to coccidioides. And again, these radiologic findings have been discussed in previous lessons. So in this image, it's a case of biopsy-proven histoplasmoma, and it's in the soft tissue window, and it shows a centrally calcified, partially cavitary nodule in the right lower lobe of a 67-year-old man. This was histologically proven to be histoplasmoma. You can see the central calcification. This is a classic appearance. Although there are multiple other appearances of histoplasmomas, they can just appear as a soft tissue nodule. Histoplasmosis can also, as earlier mentioned, can appear as multiple nodules and sometimes multiple calcified nodules within the lung. In general, viral pneumonias have a large overlap with bacterial pneumonias in imaging appearance. Classic imaging findings on CT include centrilobular or tree in bud nodules, patchy ground glass opacities, and bronchopneumonia, that's peribronchial consolidations. Then in 2020, thereabouts, there was this pandemic that shook the earth. That's COVID-19. It's a severe acute respiratory syndrome, and it's significant to know about because it was a pandemic some time back. Imaging findings are really non-specific. However, bilateral dependent lower lobe predominant ground glass opacities or consolidations are classic features. Pleural effusions, centrilobular nodules, and tree in bud nodules are typically not associated with COVID-19. So in this image, which is a case of COVID-19, it shows peripheral ground glass consolidations in both lungs, as we can see here and here. This was a proven case of COVID-19. I hope this has been helpful so far. Our next topic is going to be infections in the immunocompromised. And if it has been helpful, pass a comment, give it a like, and share to someone you think might appreciate this. Thank you very much, and I will see you in the next lesson.